I really enjoy working here. I've worked at other institutions, and it's not the same feeling as you get when you work at Rush. We really work as like a multidisciplinary team. And in the role that I'm currently in, I really get to see people grow in their nursing experience and just grow as people, and I really enjoy that. My name is Stacey Harvey. I'm the unit director of the medical ICU, and I have been at Rush almost 4 years. As the unit director of the medical ICU, I'm in charge of the hiring process for the nurses, quality control, patient experience. I do a lot of checking in and rounding with patients and their families, and if there's any sort of concerns for the patients, I'll meet with them. So the way in which I provide excellent patient care is really making sure that our staff can provide excellent patient care, that they have the resources that they need, that we have the right experience mix on the unit, that we enable them to provide the best care that they can. I would say the eye-care value that means the most to me is respect. I think that by earning respect, you've really proved yourself to the people that you work with, and by respecting others, that gets you a lot farther, and that helps enable you to carry out with the rest of the values. Well, the one accomplishment that really speaks to my experience was opening the isolation unit. We created this whole space and made these modifications and these workflows that were specifically aimed at keeping people safe in a very short period of time. And then the part that was very cool was developing the team. In October, we had some meetings prior to Ebola really becoming popular. We knew that we were going to have to plan for it. And then the patient arrived in Texas, and then the nurse contracted Ebola. And from that point on, it was a completely different mindset, which I think mostly in healthcare, we think about taking care of the patient. And it really switched to how are we going to protect and keep our caregivers safe while taking care of the patient. And it was very interesting because it was totally different than the way we usually do things, and it moved so quickly, and we were able to keep that focus the whole time. I think what makes Rush special is that, we have this world-class healthcare system, but we are in the community, and you see all different types of people coming in. There's so much diversity, not only in our clientele, but the people that we're working with. And the way we treat people among those diverse differences isn't any different. Like, we care for every person in the same way.